Learning is a lot about trying new things and making mistakes. We learn from reflecting on past experiences and analysing how we could do things better next time. But what if you work in the medical field and a single mistake could have serious consequences? Today, I'm visiting the midwifery team at Peel Health Campus and checking out how they conduct education and training that empowers midwives to experiment and see how they can improve patient care.
Peel Health Campus is a small community hospital in the Mandurah area. We provide a range of different services, including an ED, emergency department, maternity services, oncology, day surgery, elective surgery and emergency surgery. Peel Health Campus is such a lovely community-based environment. It's a really small hospital, and especially the maternity unit. I've never worked on a unit before where all of the departments, so the antenatal, labour ward and postnatal department, are all in the one place. So all of the staff work together really tight-knitly, really regularly as well. So it feels more like a family and a community rather than a workplace. So it's really important that everyone works well together and we train together.
So the midwife looks after the woman right through from pre-pregnancy, antenatally, and all the way through her labour and postnatal care as well. So we're just delivering holistic care to the woman and also the family as well.
Midwifery is about using your senses and your observational skills, your skill of touch, and listening to the women and what they're telling you and how their body is responding, and really trying to tune in with them so that you can support them in the best way that you can, especially when they're in labour.
For people that aren't a midwife, it's really hard for them to understand. They can see from the outside, I think, like how amazing it could be, and it definitely is amazing. I think some of the journeys you go through with women and their families, it's such an intimate experience as well. It's definitely the best job.
So it's really important that we make sure that all of our staff have got the knowledge that they need to be able to provide safe and appropriate care. It's really important that we're able to ensure that the staff are able to make mistakes. You know, it's really important that we honour that and we make sure that staff feel like that's a safe environment to do that. The risks that can happen, although very rare, can be quite serious, so it's important that the staff are highly attuned to be able to deal with those situations promptly and in a safe and effective way. So SimMum is a full life-sized advanced model, if you like, and she simulates different experiences. So she has a built-in computer system, super system, that allows her to be highly functioning. So she can talk to us to a degree, and she can simulate an eclamptic fit, she can have a seizure, she can bleed from her uterus, and she can birth a baby with the push of a button.
SimMum's great because it's done in a safe environment, so it's non-threatening, and it enables people to make mistakes and then to learn from those mistakes. So SimMum's really good for that.
If the staff feel confident to ask questions and learn from each other, then they're more likely to provide safe care when they're under stress in emergency situations. You can only do so much with an actress in the room with you. We can push it to a certain degree, but there comes a point where we need to be a little bit more hands-on, and SimMum really allows that. We're able to apply the evidence from all of our teachings and learnings and really put those skills into practice and hands-on experience.
I think when we do education that's on the ward with real life models, it can make it more realistic. So it can sometimes make it feel more stressful, I think, because it just helps people to sort of really see, real life kind of emergencies, and actually it is stressful, and how are we going to manage that? And then with the SimMum, it's so much more controlled. So even though people still make mistakes, it's controlled and it doesn't feel as stressful. So I think it's good to have a mixture of both.
So it's really important that we continue to be innovative with technological advances. It really helps us to deliver safe quality care that ensures that the staff are able to develop their skills and available to provide high, safe quality care. For me, the best part is that magical moment when the baby is just being born and the woman and her partner or her support people become a family, and that oxytocin and that hormone that's in the room is completely transferable to everybody in the room, and it's a really special experience, and it really helps you to remember why your job is so important. We're here to support women and their families in the community.
Midwives require a lot of skills. They're constantly drawing on their knowledge of human structure and function and practicing soft skills such as teamwork and communication. They have to think on their feet, solving problems as they emerge. Peel Health Campus's education practices and training technologies such as simulators, combined with a collaborative learning environment, allows a midwifery team to continuously upskill and practice complex scenarios, but in a completely safe environment, creating better outcomes for practitioners and patients.